Welcome back to CP24 Breakfast. Joining us live now is Dr. Isaac Bogoch, Infectious Diseases Specialist at Toronto General Hospital. Dr. Bogoch, always great to see you. I feel like it's been a while since we chatted, so nice to reunite again. This morning, though, we wanted to discuss ticks and Lyme disease. We know that this is kind of spreading throughout parts of the GTA and other parts of Ontario. Perhaps we can start with a reminder of what exactly Lyme disease is.
Sure, yeah. Thanks for bringing this up, because we certainly have a lot of Lyme in Ontario and elsewhere in Canada. This is a tick-transmitted illness, so we tend to see it in the spring, summer, and fall. Not a ton of it in the winter, of course. Tick bites you. It can infect a person with Lyme, and people feel pretty crummy, right? You can get a fever. You can get a characteristic rash. You can have some muscle aches and pains. If you're not diagnosed and treated early, it always has the potential to spread to bones and joints and the heart and sometimes the nervous system. And again, it's not that hard to diagnose. It's not that hard to treat. The key thing here is awareness and avoiding tick bites. And if people do have a tick bite, they certainly can remove the tick quickly, and they probably won't get Lyme. We have pills you can take after a tick bite to prevent Lyme from happening, they're very good, but they're not perfect. And then, of course, if people do get Lyme, it's important that people recognize that, yes, there's Lyme out there. You can get a test in Ontario that's very accurate, and clinicians also have to be aware of this as well, and keep this on what we call their differential diagnosis, because some people might have signs and symptoms consistent with Lyme. We can do a test, confirm it, and give medications to treat it. It's not that hard, but the key thing here is people and the general public needs to think about this. And of course, clinicians need to keep this on their list of potential pathogens, especially in this season.
Yeah, especially with the warmer weather. But good to know that there are resources available. So, Dr. Bogoch, here in Ontario, there have been about 20 cases a month so far this year. Very interesting, because in January, February, and March, they're usually snowy. Climate change is being pointed as a factor. So what is the strategy of fighting something like Lyme disease when climate change is contributing to a surge?
Losing battle, right? It's
Yeah.
a losing battle. Obviously, we all have to take steps to reduce our carbon footprint, but in all fairness, like, we're seeing shorter and warmer winters in Canada. Ticks are surviving and thriving in more northern climates, and we're seeing more Lyme and other insect-transmitted illnesses as we see expansion of those populations. So one issue, of course, putting the bigger picture of climate change aside and just thinking about how we can protect ourselves from infections, reducing the risk of getting a tick bite is helpful. So you can wear longer pants, and that will, if you're in the wilderness or in tall grass or in forested areas, you can do tick checks when you come back inside. And it's even helpful to have someone look at the back of your legs, because these ticks can be pretty small. You might miss them. And then if someone does spot a tick, there's an effective way to remove it. It's being shown on the screen, where you just really pinch the tick. You don't crush it, you don't twist it, and you remove it. And being aware that we certainly do have Lyme in Ontario and elsewhere in Canada. It's underdiagnosed. And if people have any questions about this, you can certainly speak with a healthcare provider. One thing that I don't think people might not know, which is helpful, is after someone has a tick bite, you can go to a pharmacy, not necessarily a doctor. Doctors can help, but we know sometimes there's a lot of challenges accessing a doctor in real time. But if you remove a tick and it's within 72 hours, you can get some tablets from a pharmacy to help reduce the risk of getting Lyme disease. You don't need a prescription. Many pharmacies across Ontario can do this without a physician's prescription. And that's one of the benefits that we've seen over the last couple of years, where pharmacists are able to provide Lyme prophylaxis. It's with a tablet called doxycycline. And it's pretty good. It's not perfect, but it's pretty good in reducing the risk of Lyme disease after a tick bite. You just have to get there fast enough to start it within 72 hours of removing a tick.
Wow, very interesting. Kind of like a morning after pill, but for ticks.
Exactly.
Okay, interesting. Dr. Bogoch, that does it for our time this morning, but always very insightful. Appreciate it. We'll speak again next week. Take care.